literally thinking about going home and going to sleep.
Good. Yeah, I've been anxiously waiting for this for weeks and weeks.
Yeah.
Did it stop raining too?
Yeah.
Interesting.
It's a bit wet. It's like a really nice view. That's what I mean. Like, walked out of here and looked across, and there's a massive park. Like, that's the park. It's like.
I know. We used to just walk across with the people from the. What's it called? Dragon Park. Take my guardians when they were good, well behaved.
Yeah, so the biopsy that come back as carcinoma.
Yep.
Possibly an adenocarcinoma that could be from lung. I think that's the most likely.
Yep.
Was there any question about your thyroid at any point, or no? No. So sometimes, because it's in the lung, it's in the brain, unfortunately. So sometimes you can't be 100% sure, but I think the working hypothesis or diagnosis will be that it's from the lung.
Yes.
You've got some spots elsewhere, but they're not,
they're not significant.
They were not,
yep.
Very, an immediate big issue.
Yep.
I think the main issue is up here.
Yeah.
Now, this MRI is from April, so it's a month old.
Yeah.
I don't know if you've been through that with.
So
you've got probably 5 or 6, 7 spots. Now, in the old days, we used to treat the whole brain with radiation, but these days we tend to try and treat them individually, which is a little bit more effective and has less side effects for most people. So have you been through the... So the immediate side effects of the treatment often not much, or a bit of headache, a bit of tiredness. When you treat the individual spots, the main side effect is 6, 12 months down the line, you can cause a bit of injury to the brain, or necrosis. Now, we can't avoid that because we've got to treat it intensively.
That's right. Local healing.
But I think that's okay. So I think, however, we're going to need, we will need another MRI to plan the treatment. I think based on what I'm seeing here, this is a gamma knife suitable patient. So I think probably the next MRI may as well be the gamma knife MRI.
That sounds cool.
So it's basically it's a radiotherapy machine. It's it's the best machine. It's the best way of treating this problem that we can have. So what we do is we'll book you for an MRI in our city branch, because we've got to do the MRI there, and we'll get a CT and then we make a mask. Have you been through the procedure? Okay.
He's done really well.
He's
literally.
Good. So now, when we do the MRI, I'm hoping it'll be roughly like what it was a month ago.
Yes.
Pardon me. I always say, look, you never know, things can change.
Probably agree a bit.
So if they're a couple of millimetres bigger, I think it's still the same plan. If there's 1 or 2 more, it'll still be the same plan. Sometimes if there's a dramatic change, like if there's another 10 or 15, you might go, gee, the rate is too quick, we're not going to keep
up with it.
We'll sort of go back to that old-fashioned.
Do the whole thing. Okay, cool. But that's still treatment. So
yeah, it's still treatment. But
you were so scared that you were going to say that there's no
no, there's definitely treatment. But when we can do the individual ones, we always try to.
100%. I like this.
Are we still waiting for molecular? They probably are.
They are,
So the only thing that would change the plan is, I think like we were just chatting to them to see if anything's come through. Occasionally you'd have on the cancer molecular changes, like genetic changes, that allow us to use very effective drugs, and some of those drugs actually work in the brain. So, sorry?
Is that immunotherapy?
No, there's immuno, which you're probably getting anyway, but there's also what's called targeted. There's certain mutations. Now, I don't think it's likely because in this situation, but we want to check, because if that is the case, then sometimes that can do a lot of the work. Now, I suspect probably because you've had headache and other symptoms, we're probably going to ideally treat you anyway. But I think we should just touch base, because if there's something taken, we might just treat a few of the larger ones and watch the others. So I think we'll try let's try and do that at the first available slot this
Yes,
week
please.
or next week.
Yeah.
Perfect.
Again,
Yeah.
we could pop him on the Neuro MDM Thursday morning, would be good.
Cool.
And then I discussed just trying to wean down the steroids.
Yeah, now you're on 16 a day.
Yeah.
16 milligrams a
Yeah.
day, 4 milligram tablets. Yeah.
Okay. I would, and you've had no headache in the last few weeks?
No.
Apart from that sharp thing?
Yeah, apart from
I don't know
yeah.
what's causing that, actually. But
I have
I
no
don't, it's,
idea.
not a it's not a usual thing we see. Is it sort of touch when you...
No, it's just like it's just
No,
There's
literally
nothing
like,
in the
just like
skull
a
itself.
sensation. Yeah.
Look, I don't understand
And
it.
it does pass fairly quickly.
Yeah,
Yeah.
I can't explain it, but let's...
it's just been me,
Thank
my
you for being
brain
honest.
just yeah,
I
being
don't know. It's
Oh,
not,
I love the honesty.
I wouldn't expect. I wouldn't expect it from what I'm seeing there.
Cool.
Sometimes you get a spot of cancer in the skull, and then sort of touch, and that can cause pain.
Oh, yeah.
no,
But we're
it's
not
like
seeing.
that.
It's not a pain. So we'll look for that again, obviously, on the next
It's probably
scan.
just a mental thing.
Yeah, you're under a lot of stress. Are you getting
Yeah.
any support, like psychological support,
No.
counselling, or anything like that?
Don't.
He doesn't like talking to people that are below his intellectual capacity.
Well, support can come from all sorts of directions, but
Yeah, I'm
sometimes it's
using like people. Like,
People, yeah. Okay.
And he's making a YouTube, like trying to offload and talk about that daily, like what he's going
Okay.
through and recording things.
all right. But it's
Yeah.
always, we have resources,
Yeah.
for
Yeah,
that if you want.
I've
Sometimes it's
used
helpful to
them
have someone
before, but-
professional outside of the family and friends
yeah.
group.
He's pretty good
Generally
at
doesn't
offloading on
help.
me.
Okay, well, that's another good reason why it's good to have another person at arm's length who's a bit.
Oh yeah, no,
Not
like
so
I've had
connected.
other people, but
Yeah.
it's just
All
people
right.
in the
Family and
profession
friends.
and
Good,
stuff.
good,
Yeah.
good. Any questions?
Is there anything that we should be massively avoiding?
So you're obviously not driving.
No, not really.
Not really.
I stopped
No,
doing
not
that
at
last
all.
week.
No.
Yeah.
She must not drive. That's
There you
like the
go.
most important thing. 100%. Absolutely must not drive.
That's safe.
Or climb ladders or use a chainsaw or anything.
Yeah.
Ah, yeah.
You know,
Yeah.
anything like that.
Yeah.
So that's the main thing. I think with the steroids we could probably drop down to 3 a day for a couple of days.
Yeah.
And I'll
Yeah.
try and
Straight
get it
away.
down to 1 or 2 a days.
Yeah.
Yeah.
Cool.
Can't do it too quickly, otherwise you get a
Yeah,
rebound.
but like tomorrow.
But let's try and
tomorrow,
gradually
take
get you
three.
down over the next week or two.
Should he be
down-
going on a keto diet?
No.
Really? Because everyone keeps going on
Avoiding
about
sugar?
Avoiding sugar and all this
Oh
crap.
well,
I've done a lot of research and I don't really know what's what.
So have you had someone check your sugar?
No.
Not
So
recently.
probably should check it. Maybe do some.
But like
had a blood
dieting.
test recently?
I don't know.
Only over at Box Hill when he was.
You drinking a lot of fluid or passing a lot of urine?
Oh yeah, I've been drinking like heaps of hydrolyte drinks and stuff.
No, but are you very thirsty?
No.
No more than normal.
You've had blood stuff
Sorry?
a week ago or so. Blood
Yeah.
stuff. Blood
Okay.
stuff a week
Yeah,
ago.
okay.
I'll
All
just
right.
double check this.
Yeah. Okay, so gradually get you off the deck or down to a lower dose.
Yeah.
Yep.
Probably take a few weeks because you've been on it for so long we can't just stop it. But
Yeah.
get the radiotherapy organised and we'll look at the MRI. So I think probably the best thing is if we do an MRI on, say, a Wednesday, and then treat, and then we've got a bit of time to sort of digest it, see what's happening, plan it, maybe treat the next day. I think most of them are suitable for single fraction.
Yeah, I can speak to Christian about
Yeah, I think they're all
yeah,
they're all small and they're not nothing's too close to anything.
yeah.
No, they're in good spots.
All right.
And then just with the systemic therapy, I'm not sure exactly how
Yeah.
it works here. I think there's
So
a
when is
tentative
your first
plan to
dose?
start
Well,
or the
tomorrow
next
we
day.
have an appointment at Marinda Breast and Cancer Clinic.
Right. So I mean, I like a week gap.
Will they be
So I
doing
guess if you're having
okay.
chemo tomorrow, then we treat you next week.
Okay.
I presume that that's what tomorrow's appointment's about.
Yeah, so-
We've really been
so-
told minimal.
Yeah, I haven't been told like anything.
They just book the appointments and then.
Like I
yeah.
thought today was gonna
Yeah.
something.
No.
Well,
They didn't
information
explain
today is
today's
insane.
about radiation and tomorrow's about chemo or anything like that.
No, they just keep booking appointments and then I have to go and find things out then.
Yeah. I mean, unless there's the other option, we're trying to sneak the brain, it's everything before it starts. But look, you're already slotted in, so look, I think go and have it. If you are having chemo tomorrow, then I think I just want that gap of a week
Yeah.
clear to the brain radiation.
Okay, cool.
Good.
Good. Okay.
Good.
Good to meet you.
Thank you so
Thank
much.
you so
My
much.
pleasure.
Like,
Good to meet you. Okay.
this is the best conversation I've had in
Thank
6
you.
weeks. So
Oh,
You've given
good
him a lot of
luck.
relief. He feels like he can go to sleep
yeah,
now.
the first thing I thought when I just walked out, I can actually go home and go to
Good,
sleep.
good. I'm glad.
Like,
Thank you
Okay.
so much.
I mean, it might be worth just chatting to the onc reg.
Yeah.
Because if there's like, if they've got a bit of latitude in when they start, maybe we could.
We would actually prefer to start the brain rather
Yeah,
than
yeah,
the
I'd probably
parts.
do the brain first if they want to put off a week or two and give us a bit of time to get that
I'll
organised.
speak to them.
Yeah, that would be
straight
perfect.
away.
Okay,
Thank you so much.
So the next steps will be, because it's a treatment that's happening at the city, but it's kind of through us. We work closely, but they'll give you a call to organise a time. I don't know exactly when that will be.
Yeah,
It will either be this week or next. It won't be longer than that.
I'm happy now.
Yeah. I will. Is this your? We've got your mobile number, I guess.
You got both of them, I think.
Okay. Who's the best person to call? Just call
Sheena
you.
is,
probably me.
Okay.
Yeah.
Sure. Call Sheena. I'll speak to the Eastern Oncology team today just about timing of things.
Yeah.
Yes.
And then I'll get in touch with you.
Yeah.
Do you
So I
want
think the appointment that they booked tomorrow was just because we'd done the PET scan and stuff, so it was booked predominantly in case they wanted to start treatment, so we could cancel it at any point.
Yeah.
But we'd rather treat the head first because I know that the other mets aren't as significant.
Yeah, of course. Yeah,
Yeah.
I can understand that. Yeah. So I'll try and I'll work out when we can treat the head. Then I'll speak to them about their timing, and then I'll get in touch with you to let you know. Do you want me to write down anything about weaning your steroid or anything like that?
No, you just said tomorrow to take it down to 3 tablets,
And
wait
next
4 or
week
5
I said
days,
2.
and see how he goes.
Yeah.
Yep, and do it
I'll
again.
drop it weekly.
But
Yeah.
stay on 2 in the morning.
Yeah, I guess
So 8 milligrams.
I'd probably do every 3 to 4 days. Every 3 to 4 days you can drop a tablet.
Yep.
Definitely don't go below 1.
Yeah.
Yep.
When you get to 2,
See
how
how
maybe stay
prolong it for 2 weeks.
maybe just a week, or 5
Okay.
days or
Yeah.
6 days, and then we hopefully will have all treated you by then.
Yeah, that's what I'm saying.
Yeah.
So,
Yeah.
Excellent.
And then the plan afterwards is usually do treatment. We give you a call in about 4 weeks, but usually we have a nurse that calls you 1 week after just to see how you're going.
Yep.
And then we just do 3 monthly MRI scans ongoing.
Good.
Perfect.
Yeah.
So you're saying the healer needs 1 targeted radiation of the
Where
brain?
if they all stay under 2 centimeters in size and they're all not right near your brain stem or anything like that, anything super critical, then we can all treat them all in a single session.
Freaking amazing.
Yeah.
Thank you so much.
And we'll do it on the Gamma Knife is the machine in the city, which it's 0 millimeter tolerances, so it's super close,
Yeah, I love that.
super
Yeah,
tight.
it's good.
Yeah. Alright. Any other questions?
No.
No. Okay.
Thank you
Thank
so
you.
much.
Lovely to meet you.
No worries.
Thank you.
Well,
Do you have contact details for us?
Yeah.
Yeah. Okay.
Yeah, I think it was in the